welcome to the ACR Bulletin Podcast, the show where we examine the latest trends affecting radiology. I'm your host, Chris Hobson, and today I'm joined by Farouk Dako, MD, MPH. At the University of Pennsylvania, Dr. Dako serves as Assistant Professor of Radiology and Cardiothoracic Imaging, Division of the Perelman School of Medicine. He is also an LDI Senior Fellow within the Leonard Davis Institute of Health and Economics at Penn. Dr. Dako, it's a pleasure to speak with you today.
Chris, it's so nice to talk to you today. Thanks for having me.
Well, thanks for making the time. We really appreciate it. Well, today I'd like to discuss your interests in both advancing radiology in underserved areas and radiologic public health informatics. For starters, please tell us about your journey to becoming a radiologist who places public health at the forefront of your practice.
It's a great question. So I actually got a training in public health before I went on to do my radiology residency. And I think that really drove my early interest. So I had just finished my MPH at Johns Hopkins School of Public Health right before I started training for radiology at Temple. And then right after that, I went to University of Maryland, where I did my cardiothoracic fellowship in addition to an image and informatics fellowship. So when you really put it all together, you get the public health angle and you get the informatics angle to really look into the field of public health informatics and its overlap with radiology.
So it sort of sounds like it was organic. It wasn't something you set out to do, but maybe through the course of your schooling, it sort of rose to that level.
Exactly. I started off definitely with an interest in public health. I would say that was my first passion. And, I believe that radiologists had a role in public health from the different, things that we do, from screening to just the impact of all of our advanced imaging and its ability to detect early disease. And then over time, I learned about the field of informatics, and I realized that you can do a lot more with the data that we got from radiology to really make predictions about patient disease even earlier than that I thought we can do before, as well as predict patient behavior as well.
Interesting. Well, that's probably important for a lot of younger physicians coming up, that you didn't have this grand plan in your mind. You just sort of, you kind of went about your business and it's just sort of surfaced. That's really interesting. Can you help our viewers better understand what data analytics and predictive analytics entail, and how they can help improve the outcomes for specific patient populations?
Sure. So, the idea of data analytics and predictive analytics it's not new really, but what is new is what we're able to do with it, right? The data sets are getting larger. The ability to mine these data sets in a somewhat of an automated way is getting better. So when you really put it together, radiology in itself is data rich, right? From the images that we acquire. But even the non-imaging part of radiology as well is also data rich. So we're able to use that to really predict, again, early disease, right? The likelihood of disease. We're able to stratify patients based on risks. We're able to predict patient compliance. We're able to predict whether or not we have a higher risk for a missed care opportunity. So we're really able to do more now.
That's really interesting. And that the way you just put that, missed care opportunity, I think that's a new construction, right? It used to be called something else, but now is that correct? Do I have that right? That's a fairly new way of thinking about that.
Right. We used to look at it as, patient no-shows, right?
No-shows.
And
Sure.
really just, I guess, putting the onus on the patients to show up to the appointment. But, as folks have got a better understanding of the complexities of these things, we realize it's just a missed opportunity for care. And there are reasons why it happens, and the better we understand that, the better we can sort of deliver care in a way to reduce the chances of that happening.
Speaking of improving the health of populations, in a 2016 JACR article, you mentioned that the World Health Organization considers one of the three main functions of public health to be ensuring that all populations have access to appropriate and cost-effective care, and that includes health promotion and disease prevention services. So you've already mentioned a little bit about the role radiology can play in public health. Can you elaborate on that a little bit, please?
Right, definitely. So yeah, so we talked about the different opportunities for radiology to improve health, right, and prevent disease, detect disease early, potentially in a preclinical phase, right? So when we think about things like mammography, right, for breast cancer screening, DEXA scans for osteoporosis, we can think about lung cancer screening with low-dose chest CT, coronary artery calcification as a risk for coronary artery disease. These are all things that we can be more involved in the design of the delivery of these to our patient population. We can also be involved in educational outreach efforts to talk to patients about the need for these studies, to explain to them what the experiences are going to be like, right? We've all encountered too much, patients showing up and not really having a good experience while they get these studies. And part of it is because they're never really prepared for what it should be like. And that really affects their likelihood of returning for these services, especially when they're screening services that are not really dealing with an acute situation, right? So understanding that patients are individuals like anyone else, and they have other more pressing issues. And it's important to look at, what the things we can do to make sure these services are delivered to them in a way that's more likely to be used by them. So we talked a little bit about predictive analytics, right? So radiologists can be involved in making the determination for where in a healthcare enterprise the CT scans should be located, right? We can look at, the patients, the times patients couldn't make it to their appointments and we had this missed care opportunities. Was it a certain time of the day, right? Was it a certain day of the week, right? Was there an association between the distance that these patients lived and the location of the CT scan is? So we really have a lot of data that's in place that we can really analyze and help answer these questions as to how to better deliver radiology services.
And I guess that played into my next question about healthcare disparities and radiology. But it sounds like there's a big role for radiology to play in that. Well, to address healthcare disparities, you come out strongly in favor of getting outside of the dark reading room and engaging directly with communities and with people where they are, more so than anything. So whether that be working through faith centers or community centers or even senior citizen centers, do you envision radiologists getting more involved in the real world like that? And if so, how can they do so?
Great. So, I firmly believe that we really learn more than we really get more from other people involved when we go out there, right? We really learn so much and make a connection with people in the community. And at the end of the day, it's about people, right? Like, people really, our feelings about people determine what we do next. Right. So one, it's just important for radiologists to be exposed to people in the community and talk to them and understand who they are and, humanize them a bit, right? Especially given the fact that we don't get to see them a lot, right? So that's one. Two, that really helps us with the next step, which is how can we better design our services to meet their needs, right? So we need to go out there, build some trust with people, right? Get to know them, before we can go ahead and design an intervention. So I'll give you an example. A couple weeks ago, my department, a lot of my colleagues in my department at UPenn and some residents, we went out to the community. We went to a church in partnership with the Obama Foundation to do an outreach for COVID-19 education, as well as sign people up for the next community vaccine clinic. And the foundation with their fellow Khadija were able to get donations from surrounding grocery stores, so Whole Foods and Trader Joe's, Sprouts. And it was just one day, right? But people from radiology came out, got to meet people in the community. They got to meet us, and they got the food. We signed some people up for the COVID-19 vaccine. Oh. But even more importantly, now, the church is reaching back out to us to say, hey, listen, like, we want to work with you guys again. So now in the next conversation, we can start to talk about, all right, let's introduce other things like health promotion for lung cancer screening, right? So like get a better understanding of why people, why the uptake for lung cancer screening isn't that great, right? We can start these conversations. And then we can start to design approaches to fix that, right? Mm-hmm. Maybe help with transportation, maybe help with, the timing of when the studies are taking place, maybe help just people navigate the complexity of the healthcare system. I mean, just understanding what is in your doctor's note sometimes can be so difficult. So there's a role to play, but it starts with making that contact.
That's great advice. And as keyed in as you are on the local level and community involvement, it sounds like you also have an interest in globally in enhancing radiology's role in global health promotion. So it's an interesting dichotomy. So why is that this global health promotion such a priority for you as well? And what do you see as radiology's role therein?
Yeah, so I mean, I really see it as a continuum, right? So it's global. America is part of the globe, right? And there's disparities in care that are regional, but there's also disparities in care that are global, and you can't ignore one or the other. My introduction to global health really happened while I was doing my MPH as well at Hopkins. I met with my advisor, and he was like, you know what, based on what your interests are, I should introduce you to this organization called Radiology. Mm-hmm. So this was in 2015, before I even started radiology residency. He sort of told me about it. I reached out to the organization, and I've been working as part of the organization since then. And there's a famous sort of quote, which is 2/3 of the world's population has no access to diagnostic imaging, right? So that that's something that should not be ignored.
So in a similar vein, you co-authored a recent paper about the limitations faced by low and middle income countries when it comes to implementation of something like artificial intelligence or AI. Insufficient local equipment, personnel expertise, infrastructure, data rights frameworks, and public policies were all highlighted as just some factors in your paper. Why is AI so important to global health first? And second, what can radiology do to improve the situation?
Yeah, so AI is, as you know, is something that's being talked about a lot right now, with a lot of potential. And as much as we haven't realized its true potential, it could be a wedge that worsens the health disparities between the haves and the have-nots, right? Between the high income settings and the low income settings. So, how do you make sure that low income settings, low and middle income countries have an equitable, access to AI, given their own unique situations that are specific to the different regions, right? So it's really important to, one, include these regions in the creation of the AI products, because if they're not included, that could introduce bias. Just like clinical trials in medicine, it affects the generalizability of the product if the population involved in creating it, it's a narrow population, right? So that's the case for data diversity, and also the case for making sure that they are involved in the rollout process. So one, their data is being used to create these algorithms, and then they get access to the finished product. Because we don't want the situation where AI turns out to be this wonderful thing that really takes medicine to the next level for only a certain group of people. So in the paper, we really try to say that based on what you mentioned, the differences in personnel infrastructure, there needs to be a unique approach to AI in these regions. So we propose a three-pronged approach of clinical radiology education, infrastructure implementation, and a phased AI introduction, right? So you have to understand what the particular region doesn't have first, and try to make sure they're ready for potential AI products. So make sure you're doing you're teaching folks about what AI is and how to validate and appraise AI products, right? You're making sure they have the right infrastructure. So do they need a PAC system, for example, installed first, right? Do they have the right internet to be able to use certain kinds of products that require that? And lastly, do you want to just throw a bunch of things at them, which we know doesn't work anywhere? Or do you want to sort of pilot things in phases and take it from there?
To conclude, I just wanted to ask you a couple of questions about the future, in these areas. First off, what do you envision for the future of radiologic public health informatics, and how it will be used, to advance radiology in underserved areas, as you've already alluded to before? And I guess secondly, what is the future of radiology's role as a catalyst when it comes to global health promotion?
I think radiology as a field is more set up than most other fields for global health, right? Just the fact that, things can be done remotely without really losing anything as far as quality, right? So education could be done remotely. You can have joint readouts with trainees all over the world, basically on the same computer. We're sort of leading this wave of artificial intelligence, given the fact that our specialty is data rich. So I really do think we have an opportunity to take a leading role in the next phase of healthcare evolution, which is more globalization, right? Because we're set up for that. So I really do see us as leading this new effort. I think it's important for radiologists to embrace that and embrace their role in that, but understand that ultimately, like I said early on, it's about people. So it's important for us to get out there, to talk to people, to really get a better understanding of healthcare delivery, social economic determinants of health behavior, things that really require leaving the reading room to get a good grip of. So I do think the future of radiology public health informatics is bright, and I'm very excited to hopefully be a part of that movement.
And it sounds like a lot of the same principles hold, whether it's you're focused on the community, the local community, or global health promotion. I mean, so, as far as addressing social determinants of care, making sure that you've got the right technology, and really getting out and learning who the folks are that you're dealing with. So I guess in that same vein, what do you think the future is on a global scale with health promotion, and how can radiology be a catalyst to that?
Yeah, I mean, I think, like you said, the same things hold true. I think we have the ability to really create a global community in radiology better than most other fields. And we have the ability to really tackle the issue of equity, right? Because one of the tenets of quality care is equitable care. And one of the biggest reasons for poor quality is inequity. So I think we as a field we're typically data driven, we really could to keep the focus on data, right? Keep the focus on science, and I think we could build a global community that is really supportive of one another.
That's a really optimistic note to go out on, and I think you're right. Now, Dr. Dako, thank you so much for the interesting conversation. I'm wondering if people want to, continue this really important conversation, can they find you somewhere online?
Yeah, for sure. I'm on Twitter. I don't tweet a whole lot, but I'm always there liking stuff. They can catch me at Farouk_Dako as my Twitter handle. So excellent. Yeah, for sure.
Yeah, that's great. Well, speaking of Twitter, for our listeners, if you have any future show topic ideas, you can reach out to the ACR Twitter handle at Radiology ACR and just include the hashtag ACR Bulletin Podcast. And please let us know what's on your mind. I also invite you to check out all of our episodes, our prior episodes, which are on Apple Podcasts, Spotify, Google Podcasts, and ACR's own YouTube channel. Thanks again so much, Dr. Dako, and really thanks to our listeners. This has been the ACR Bulletin Podcast. See you next time.